All right, welcome back to the broadcast. You're watching TV47 Weekend Edition. It's time for To The Point, and as you can see on your screen, we are talking about Mental Health Awareness Month. Our conversation tonight is based on this year's theme, which says it is time to prioritize mental health at the workplace. This is according to WHO. And I want us to take a look at why WHO says this is important, if we can have that displayed on the screen as well. Now, WHO says that workers have a right to a work environment that promotes their mental health and well-being, aligning with the broader principles of occupational health and safety. The WHO also outlines a practical framework for governments, employers, and health service planners to implement strategies that prevent work-related mental health issues, support mental well-being, and assist those affected by mental health conditions. According to WHO as well, poor mental health at work can lead to decreased productivity, increased absenteeism, and higher healthcare costs. Conversely, promoting mental health can enhance employee engagement, retention, and overall workplace morale. And finally, as to why this theme is important, according to WHO, is that it emphasizes collaboration among all stakeholders, including government bodies, employers, and civil society, to create a supportive environment for mental health initiatives in the workplaces. Now, like I had mentioned earlier, guests are already with me in studio. Just right next to me is Sophie Wambui, a clinical psychologist. And right next to Sophie is Victoria Rika, head of corporate mental health and wellness programs at the Chiromo Hospital Groups. This is an all-lady panel today. Karibuni sana, ladies. You look lovely.
Thank you.
Now, just to start us off, why do you think this year's theme is quite important? Now that you work in the corporate field, Rika, let's start with you.
Well, the theme for this year being prioritizing mental health at the workplace is quite important. Where I work, for example, at Chiromo Hospital Group, it's a level 5 mental health facility, meaning that it's high pressure environment because we deal with mental health patients. Well, we all have mental health, but we deal with patients who are struggling with mental illnesses, right? So if you do not prioritize the wellness of the people working there, then you may end up having them as statistics as well. So we have attempted, or rather we have succeeded. Actually, we are, I would say, very far in terms of trying to prioritize the wellness of the workers who work within our organization. How do we do that? For example, we have what we call Employee Assistance Program. Now, this is an employer-based initiative which takes care of employees who may be struggling with any issues which are hindering their productivity within the work environment, which means then we cannot talk about the productivity of the work environment if we do not, first of all, define what mental health is. And again, from the World Health Organization, it's simply a state of well-being, state because it can change, whereby you only look at 4 parameters. Number 1, you're able to realize your full potential, your full abilities. Number 2, you're able to cope with the normal stresses of life. 3, you're able to be productive and fruitful within the work environment, wherever it is that you have in a call of duty. And then 4, you're able to make a contribution to the community. So if you're not able to meet those 4 parameters, then we see already your mental health is compromised. So if an employee is struggling with something, it could be they've gone through maybe loss and grief. They could be having a chronic illness which they are struggling with. And of course, it's hampering their productivity within the work environment. So we have in place what we call Employee Assistance Program, which then now takes care of that employee by referring them to resources such as psychologists to help them to process whatever it is that they're experiencing, so that they recover and they're able to come back to the work environment and be productive.
This employer assistant program, is it only at your organization, or do we have organizations that have such programs?
We do have organizations that have those kind of programs, quite a number of them. And we do also, as Chiromo, run EAPs for other corporates. So they come to us and tell us that this is our workforce, these are the issues that we are struggling with, and we want you to take care of our employee issues. So we run their EAP programs, but there are others that already have internal EAP programs. So you can actually have an internal EAP program, you can outsource, or you can do hybrid. So you outsource, and at some point you also do what? Run the internal program.
All right, Sophie, what does it mean to prioritize mental wellness in workplace?
Well, as Victoria has mentioned, we've said it's a state of well-being where you have to consider whether this individual is able to reach their potential abilities, whether they are able to give back to their community, as well as being able to cope with the normal stresses in life. So remember, we work for probably 8 hours in an organization. That is where we spend most of our time in that organization. So we need to prioritize so that we can fit in what has just been described as a state of well-being. So that's why we are supposed to prioritize mental wellness in our organizations. Basically, is to make sure this employee, is he able to identify his abilities? Is this employee able to go back to their community and be able to give back? You know, that is going back to their families, to their relatives, the social life. And also, are they able to cope with the normal stress life? If in that organization does not give them that environment to be that whole individual, then we will not be prioritizing. So that's why it's important to prioritize mental health or well-being in the organizations. We have to, because that person will still go back to the society. Yeah.
Now, before we started this conversation, there was a light moment here in studio. Mental health ni ya wenda wazimu, right? Now, if you're still talking about mental health being for the wenda wazimu, it means that there's quite a bit of stigma. But we're in 2024, so haven't we made any strides in trying to fill these gaps in terms of informing the public about mental health? Sophie?
All right. I remember there's someone, when we started creating awareness on mental health, and I remember someone said, that kind of information is for the whites. I mean, they feel like it's not meant for the Africans, which is a very backward way of thinking, I will say. But I've also seen a huge contribution being done by psychologists, counselors. People are coming up with seminars so that they can create information. So we are heading there, but there is still a lot of work to be done because we realize even for the young people, we still have the information gap in regards to what mental health is. So I feel like we still need to do a lot, but I don't want to discredit the work that is being done by the counselors and the psychologists, the seminars that having seminars, workshops. We have all those seminars that are addressing mental health. Basically, they are trying to create mental health awareness, but there's a lot of work to be done. Maybe Victoria can add on that.
Haven't we done enough as a country to try and just eradicate stigma around mental health at all?
We've done quite a lot, but there's also the issue of self-stigma, which is actually now more damaging than stigma from the public. Social stigma or public stigma is you have HIV/AIDS, so I don't want your company. But self-stigma is I have HIV/AIDS, so I'm not able to relate to other people because what will they think about me? So if we are able to help people to go beyond the self-stigma, then social stigma becomes, less, right? But we have made a lot of inroads. Mental health issues are not what they were 3-5 years ago, right? Because there's so much awareness being created by the public. Not only mental health facilities, but also organizations are now having mental health sessions. And COVID really did a number where mental health is concerned. People suddenly realized we need to have this mental health awareness. Why? Because COVID really impacted on people. And they were wondering what's happening to me, what are these symptoms all about? And organizations which had people who were serving in terms of mental health awareness were able to get to mental health professionals. And the stigma is slowly going down. My boss, Dr. Frank Jenga, who you've just shown on the screen, said, if you're still stigmatizing, you're actually on your own. Yes.
Right. Yeah. All right. Let's take a look at WHO recommendations in slide 3, if we can have that. Now, WHO recommends manager training for mental health, which helps managers recognize and respond to supervisees experiencing emotional distress. It builds interpersonal skills like open communication and active listening, and fosters better understanding of how job stresses affect mental health and can be managed. Now, we have instances, let's just stick there for a bit. We have instances where an employee maybe tells the supervisor or the boss that I'm feeling some type of way. I feel mentally fatigued. I don't know if that word is being misused, but you can find that an employee could tell the boss, I'm feeling mentally fatigued. But the supervisors sometimes don't take this with the seriousness it deserves. Now, what can we do as a concerted effort to ensure that this employer is really catering to the employee in terms of kuelewa huyu anasikia hivi ni mgonjwa, let's tend to him or her. How do we get to that point?
Basically, we've just mentioned about the employee assistance programs. And if you look at some of these programs, they usually categorize trainings in different groups. That is, if we have the top level management, the supervisors, and later the employees. So during the training, they are not trained together. So if at all we can embrace trainings on mental health, like if it is the supervisors, they have their specific day, or they have their specific information on how to address how to handle the people who are under them. For instance, we can just have trainings on the common symptoms or the common mental disorders, like we have the depression, we have anxiety. We can also talk about burnout, stress. If they can have training just on the basic, like you don't really have to be a counselor to do this, but if these managers or supervisors can be trained on just the basic or the common mental illnesses, then I think we'll be good. They will be in a position to embrace other people. Yes, so I feel training will work, and also we need to appreciate or embrace the employee assistance programs at workplaces.
All right, Rick, I know you've mentioned these employee assistance programs, but for those companies that don't have it yet, but you see, like I've mentioned, this supervisor keeps turning down the employer, when he comes to tell him or her, I'm not feeling okay, then what needs to be done?
Now, let me tell you the secret of getting management to own the whole concept of mental health within the workplaces. It's by showing them the statistics. And we say it is a top-to-bottom approach. If the management does not own the whole story of mental health within the workplace, it would be a non-starter. But if you show them the statistics, for example, World Health Organization says that globally, depression and anxiety costs what? A whole $1 trillion.
Correct.
Right?
Yes.
They project that by 2030, it will shoot up to $16 trillion. But if you tell the employers, if you invest $1 for the management of depression and anxiety, you'll get a return of $4 on better ability to work and better mental health. So if you show them those statistics, they know then that there's a return on investment when you invest in mental health. So try to get the top people to own it, try to get them to role model, because there's no use of having an employee assistance program which the management is not using. Then what does it turn into? It turns into a disciplinary kind of a concept. Because now HR sends you there when you are absent too many times, or when you're asking for too many absences, then HR is sending you there to show cause. But if you get management to understand that I could need a mental day off, and especially the Gen Zs, they're very easy on asking about their mental health.
Right.
I need a mental health break. But we people who are still stuck a little bit in terms of talking about our mental health are the ones who are suffering. So it's also about creating that awareness, not only to the employers, but also the employees, that you actually have a right. As per the Mental Health Act, you actually have a right to perfect optimum mental health, and the workplace must be enabling. So let them also create what we call a psychologically safe space, that the employees are able to talk about things that they're experiencing which can impact on their mental health. And once you get the supervisors, the line managers, the people in management to own that, then it becomes easy.
The story that we just played that formed the basis of this conversation today, Kop Shakur is saying he is on the verge of, what did he say? There's a word he used, resigning. He is on the verge of resigning. Now, for someone to get to that level, he's at work currently, but his mind is on resigning. How can he be helped? Because literally his mental health is deteriorating day by day. Sophie.
You see, at his point, and maybe that's where sometimes employees sometimes go wrong, is where we do self-diagnosis, where you come up with your own, you Google and get your own condition, yeah? But maybe for his situation, before even he resigns, because sometimes you may be pushed, most of the times especially when you're suffering from burnout, you may feel like you resent your job, you will really want to resign, but what if he decides to give a professional a chance? And sometimes we are afraid of seeking professional help. What if he seeks a professional help and maybe he is able to address the burnout or whatever he's going through, or he gets a proper diagnosis of what he's going through, and once he gets the treatment, basically he'll definitely go back. But I feel he should talk to a professional. Yes.
Rika, what do you think of Cop Shakur's case at this point? Because he's complaining, the police force, they don't have unions, they work on orders. There's a lot going on in the police force, according to Cop Shakur. Now for them, what can be done?
I think I concur with what Sophie is saying, that maybe resigning may not be there. I don't know, the right decision, we can put it like that right now, but we also don't know the circumstances. And when you don't really know the whole story about a client, it's usually not very easy to make, you know, to come to a conclusion. But really, when someone is coming to a point where I want to resign because I'm having a really hard time at the work environment, I would want to understand what resources have I looked at? Because, for example, at the facility where I work, we see very many policemen who come there because someone is probably in a hardship area, someone is going through financial challenges, someone is going through alcoholism. They come and they get the help that they require because there is an avenue to that. So I don't know, I would want to understand, has he explored that avenue? And then again, it also comes to a point where if you feel you're completely self-aware and feel that this environment is really, really torturing my mental health, and you have a place where you can go to, because remember, you also have bills to pay. And you might actually be leaving that job and getting into a deeper quagmire. Because we don't know, is it depression which is pushing him to a place where he wants to resign? Because the symptoms of depression also are things like, you know, a lot of helplessness, a lot of hopelessness. You feel like nothing is going to work for you. You feel like nothing can help. So has he explored those resources before he resigns? Because it could be depression pushing him to resignation. And once he resigns and has got no way of paying his bills, then the depression may become more pronounced, which may leave him in a very vulnerable place mentally.
All right. We've also talked about a couple of terms, which I would love for you guys to try and expound on. You've talked about burnout, we've talked about mental fatigue, stress, and workplace anxiety. Now, kindly tell us, how do they differ, these four?
All right, maybe I can talk on burnout.
Yes.
You see, when you are exposed to chronic stress, it's completely different with stress. So when you are exposed to chronic stress all the time, your body gets exhausted.
What is chronic stress? How does it feel like?
Okay, well, chronic is continuous from the work demands, workload, pressure. I mean, there is no break for you. You know, ideally, the body should have that moment where it can bounce back to its normal state. That is when you're a bit stressed. Like, you see, like for now, you're breathing well, your digestive system is okay. But when you experience a life stressor, definitely you either go, your body just goes maybe into a fight or a flight mode, you know. So how well are you able to go back to your normal state? So that is what we talk about stress. But now the burnout is where you have so many life stressors or things that are getting you out of balance continuously, persistently, you know. Yeah, so you get to a point where you're emotionally exhausted, psychologically and also physically. So sometimes, especially for people who are working and they are experiencing burnout, you find people who get detached with their work, like they resent the work that they are doing. Probably someone loved their jobs when they started, but 3 months down the line, they are completely detached from their work. They really even have, like, they don't want to wake up and go to work, you know. And also you find they have a negative attitude towards their colleagues. Like they start thinking, these people, I can't even trust these people, you know. And before probably they were working so well. So burnout it's really exhausting. Emotionally, you get very tired. You can have anger outbursts, you know. Probably you are just okay 1 month down the line and you are shouting at people, you know. Yeah, and then physically also, burnout affects emotionally, psychologically, and physically. On physically, you may feel like maybe you have back pains, you could have headaches, you know. So it's always important to check, yeah.
Right.
Yeah.
So, Rika, is this really same as work anxiety, burnout and work anxiety? Are they one and the same?
No, I think Sophia has explained properly what burnout is.
Yes.
accumulated stress, you know, a lot of stress. And when you get burnt out, really, you really don't care who is asking for what project or for what report. Say, even if it's your boss, you really don't care. You're that burnt out. You just want to detach completely. But now, you've asked about work anxiety.
Right.
You know, anxiety is different. We have what we call generalized anxiety, for example. We have what we call social anxiety. And anxiety disorders, we have quite a number of them. But for example, if you have social anxiety, it means that you have a problem with being in crowds, with being with people. You don't feel like you want to go out for those weddings, for those meetings, for those birthday parties. You'd rather be alienated from people, right? But you could also have what we call generalized anxiety. Basically, anything or nothing makes you just anxious. And you have those symptoms. You feel like, for example, you're told to do for example, a session by your boss, you're told to do a report in front of your colleagues, and you have heart palpitations, you start trembling, you're sweating, suddenly you want to use the bathroom, your stomach, you know, and all that, then would say you have some sort of anxiety. So they're quite different in the way they manifest themselves. Yeah.
I want us to take a look now at the national guidelines on workplace mental wellness. That is in slide 4 in Nonde. We have employee and employer responsibilities, where employers are required to create supportive work environments that provide access to mental health resources. We've talked about that. Employees are encouraged to practice self-care, build coping skills, and seek social support when needed. We have mental health integration, where the Ministry of Health says mental wellness has been integrated into the country's broader universal health coverage goals. And mental health in the workplace has been prioritized in recent years, aligning with international standards for employee well-being. We have mental health conditions in the workforce, where approximately 3.7 million Kenyans in the workforce struggle with conditions such as anxiety, depression, substance abuse, schizophrenia, and bipolar disorders. All right, now the guideline highlights it advocates for a comprehensive approach that includes promotion, prevention, and support of mental health. They emphasize the importance of reducing stigma and fostering open conversations about mental wellness at work. The guidelines have specific provisions for high-risk professions, such as police officers, recognizing their unique challenges. Now, this point where it talks about high provisions for people such as police officers, for instance. During the World Mental Health Day celebrations on Thursday, there's a guest who mentioned, that was the chairperson, Kenya Board of Mental Health. He said that insurance companies do not cater to people suffering from mental health. Now, how do I get treatment if I'm now suffering from a mental illness and I need to get treated for it? Sophie.
Now, in some of the organizations, there are some insurances that cover that, and they also provide, like, will I say, an active psychologist. So instead of paying for the insurance, the company allow you to just have a counselor that you can call at any time. But then, right now, for the mental health charges is a bit high for now, but for those who cannot afford for the insurance, you can consider the public hospitals. For instance, like we can have the Mathari. There we have counselors, and it's very affordable, by the way. So for those who can't afford the insurance, those who cannot benefit from the insurance covers, then maybe they can try the public hospitals. Yeah. Or again, I usually tell the young people, as you budget for that phone, because we are paying even for phones that are worth 100,000, mental health, if you get sick physically, you will go to a hospital, you know, but you can also budget for mental health. Like you will say, this month I'm willing to pay for 1,500 or 3,000 or even the 300 to the public hospitals so that I can access the mental health services. Yeah, so you shouldn't feel limited just because an insurance, you're not benefiting from these insurance covers.
But Shrika, should we have this insurance that covers for mental health issues? Why is it so high?
Well, most insurance companies actually do have a provision for mental health services. Again, there's also lack of knowledge because I've gone to corporates and they're asking me how much do we pay for a session at Chiromo Hospital. They're asking about how much if they come, how much cash will they pay. Then I ask them, what insurance are you people on, medical cover? And they tell me, and I tell them, but you can come and use your card. Yeah? And your card has probably a limit when it comes to inpatient, but most insurances do cover even for outpatient. Now, the sad part is for those who cannot afford it, because if you're not working in for a good corporation, then you will not have that insurance. But again, at the county hospitals nowadays, there's usually a sitting psychiatrist and a sitting psychologist. So again, knowledge, that information is what we need to now spread out there and tell people you do not necessarily have to have insurance to come to a medical, to a mental health facility. But you can go to one of these county hospitals and you still get the services at that level.
All right, another interesting remark that was made on Thursday is that workplaces are enablers of mental health issues. A reaction to that, Trika?
That's true, unfortunately, because there are so many things that happen within the work environment. So there could be issues of sometimes overload, too much work. There could also be the issue of role ambiguity. So I was taken in as a psychologist, but someone is actually telling me to do something in procurement. So I'm not really sure about what I'm supposed to be doing. And of course, there's then what is now a late term, one of the latest terms of incivility within the work environment. You know, bosses who are bullying you, they're being very impolite, they're using very uncouth language and they're addressing you. So all that now creates an environment where we call it a toxic work environment. So even the hours sometimes, you may work very crazy hours. I think we talked about, I had somewhere where they're talking about you need to sleep next to your laptop because your boss is going to send an email anytime and you need to respond to that email, you know? And so this is where you talk to your employees and also tell them that it's important to create boundaries. It's important to be assertive and also stand up for yourself and look at what are my mental health rights. Because remember, if you push these employees in that kind of a toxic work environment, at the end of the day, their productivity is going to go down. And what I'm saying is, talk to the management about what that will do to their business, because they also need to look at the margins. Yeah.
Sophie, workplaces being a breeding ground for mental health issues. Now, how do we get help?
One, let me first appreciate this program because most people are watching what we are doing today. So we are doing a good job in regards to this. But now in workplaces, I always say now, sometimes you really don't have to look at the employer. You have to be responsible of your mental well-being. Because today you will work for those excess hours. Tomorrow we don't have you. You know, it will be at your own cost, you know. So mental well-being, taking care of your mental well-being is your responsibility. And I think even employees need to embrace that. If you are in a toxic environment where probably communication is not even good, because there are places where communication is very poor, or where we've had harassments, bullying, I think it's upon you to choose. Do I really first, you first seek a professional help as an employee, because that is their responsibility. Then number two, what we need to do is, you see, like we have organizations, and I think, is it this year where we have the national guidelines of mental well-being that was launched.
Yes.
Yeah, it was launched. What if this organization, and I'm sure most of organizations are not aware of this document, and it has very nice guidelines on how to incorporate mental well-being, the guidelines and policies in the organizations. What if we start there? What if the HR starts having the mental health champions in different departments? You know, so that if it's, maybe we have the production team, they will know so and so probably is not okay. Even during meetings, they are able to have statistics. Our department has someone who is showing this, these symptoms, you know. Like, I'll give an example of where I work. There was a whole team that was picked just to be trained on basic counseling skills. You know, maybe that is something that organizations can pick. Like, it can invest and budget. It can budget and invest on particular people from different departments just to make them mental health champions. I think with that, even the people that you are working with, you will be in a position to pick someone who is absent for work. Maybe it has become a constant thing. Or someone who is not able to, their appetite has changed, someone is losing weight, and being in that department is able to, that there's a problem with that person, you know. So I think we embrace the guideline. We can take the guideline, go through it, embrace what has been advised from that, from the national guidelines. And I will also say, Trainings. Yes, trainings are very important.
All right, Rika, due to the interest of time, your parting shot maybe, in line with this year's theme, why is it so important as we close, and what is your call to action?
We still belabor that line that it's quite important for you to be mentally healthy. I almost said wealthy. I think it also applies at the work environment, right? Because remember, if you get mentally unwell, like she mentioned about stress, and stress build up will lead you to a point where you also become medically unwell. So you will find yourself at the medical facilities, not because you actually need medical help, but because you need to see a psychiatrist or a psychologist. So you need to also now understand those symptoms, and they can be actually very limiting. But I also did carry along these. We call them self-assessments. You see that you will assess yourself for your high blood pressure. We say you make use of these resources. These are resources that you can actually scan, and you'll be able to assess yourself for burnout. You'll be able to assess yourself for depression, for anxiety. For those who love alcohol, you'll be able to assess yourself for alcohol, and even for what we call post-traumatic stress disorder. Now, this is just the way you take the readings for the blood pressure. If the pressure is too high, you don't necessarily go to the doctor that particular day. You can say, maybe let me see how it will be tomorrow, and you take the reading again, and tomorrow it's probably okay. But if the pressure is consistently high, then what do? You need to go to hospital, isn't it?
Right.
So we have these resources. We can also embed them in websites, at the request of any client, and your employees can be able to just assess themselves for their mental health.
Right.
And then they can also always get in touch with a professional to help them, manage their mental health. So please, for those who may be out there struggling with poor mental health, it's important for you to get help, because a diagnosis is always better than living with something that is not known.
All right, thank you so much, ladies. We are past time. We have eaten 4 minutes of the time right here. But thank you so much for making time for this conversation. This is one conversation that cannot be overemphasized, that is mental health. I'm looking forward to hosting you some other time to have this conversation in broader length. Thank you so much for watching. That was Dr. Victoria Rika, Head of Corporate Mental Health and Wellness Programs at Chiromo Hospital Group, and Sophie Wambui, a clinical psychologist, helping us understand more about the importance of this year's World Mental Health Day theme. That is, it is time to prioritize mental wellness in the workplace. Thank you so much for watching. My name is Anne Odida. Our sign language interpreter tonight is Calvin Makori. Do have yourself a good night, and see you next time, inshallah.